Wadri. She's a pediatrician at Kolebu Teaching Hospital and the CEO of Baby, Child and Co. So every child is unique and you all want to see your children grow up in a healthy way. However, some children reach their developmental stages at different times. So when is it too early and when is it too late to be crawling, turning your neck, walking, talking? And when there are delays, what can you do about that? Our conversation on developmental delays in children starts right now with Dr. Cerebral Palsy. Good to see you.
Good to see you.
Good morning.
Good morning.
Let's talk about development in children, first of all, and then we can look at delays. Why is this such an important topic we're discussing today?
It's because developmental problems, if you add them to behavioral problems, they are actually the commonest disorders among children and adolescents worldwide. And it's important to talk about them because when you want to correct them, the earlier you start any intervention, the better the outcome. So if you didn't know, then you don't bring it to the attention of whoever can make an intervention for you. And also, children with developmental delays, they tend to become abused. It's like nobody really understands what's going on with them. We label them as truants, disrespectful children, and then they are at risk of abuse. So these are all the reasons why it's important that we know about them and then we seek intervention for them.
What are the different developmental delays that parents should look out for?
The commonest developmental delays we have are speech and language impairments, and then we also have cerebral palsy, and we have hearing impairment, we have attention deficit hyperactivity disorder, autism-spectrum disorder, and the list goes on and on.
Let's start with the one you mentioned first, the speech and language impairment. How does that manifest?
It manifests grossly as a child who is unable to speak. But even before the child begins to speak like speech that you should understand, there are other things they do before. For instance, at a certain age, the child should be cooing. That's like the small noises they make, and then they start to babble, blah, 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 before they begin to say single words. Yeah, so when those things delay, it should tell you that there's a problem. By the time the child is supposed to say single words, and the child is not saying, then there's a problem. But usually you see that we wait till we expect the child to say, Mommy, I'm hungry. And when the child is not saying, Mommy, I'm hungry, then we all know that there's a problem. But even before that, there are things that you could look out for and then wonder whether there's a problem or not. There's a very important milestone, which is pointing. You know, when a child sees something that is exciting to the child and wants to share it with the mother and so on, they point at the thing, you know, even though they can't speak. So all those things are things that we should look out for even before it is time for the child to say single words or even string words together to make sentences.
Are generally parents aware of what to look out for? Is there some education that you give them before the baby is born and even after the baby is born?
Yes, there's education that we give them before the baby is born and after the baby is born. Every encounter with a healthcare professional should be a screening. There should be developmental screening for any child who encounters a healthcare professional at any time in their lives. And then you find that children who belong to large households and then mothers who have had babies before, they have this ability to pick those things because they are like, okay, somebody talked at 1 year and this one is not talking at 1 year. So they also have that ability. But every encounter with a healthcare professional, if you have a baby or a child, it should be used as a screening opportunity. So you ask questions, what can the child do or not do? And then you see that the child is doing well or there's a problem that needs intervention.
Are you saying that if a child is a first child living in a small household, there are no other children to compare with, parents may not pick up on developmental delays just because there's no reference point?
That may happen. I don't have figures to back that, but what we usually see that those that are coming from households where there are other children, the parents are able to pick those things up fast because they tend to compare with others. But then there's also a disadvantage when you are comparing your children with others because, like you said in your introduction, children are different. They all do things at their own pace. Some are fast walkers, some are fast walkers. But then obviously when there's a very big gap then it's a problem. But when you are comparing, you have to be careful, because where somebody may walk fast, somebody may talk fast, and so on. And even cultural contexts vary. We know, for instance, that children elsewhere tend to talk faster than us Africans, whereas we walk faster. And then,
sorry?
Yes, we do.
African babies walk faster?
Yes, we do.
Why are we in a hurry to go?
I don't know. And then also, you find that certain things that are, that the parents pick on as problems in certain cultures, we don't pick on those things as problems here. We will say, oh, okay, this is they don't respect or something. Whereas somebody will say that, oh, maybe the child, is it a hearing problem? Is it that the child is not understanding what I'm saying? That sort of thing. A child can write somewhere quickly, it's a problem. But here, maybe you are lazy, you know. So cultural context also tends to vary.
Do you think that they tend to over-medicalize issues abroad?
I don't know, I'm not abroad. I can say that we are not...
What does the literature say? I mean, are they quick to medicalize things?
So I've read some things, and then I'm not sure, because, you know, abroad, I know that there's a lot of support for you. So if you had a child who was disabled, so you are quickly, you know, you are in a hurry to quickly disclose that you have a child with a disability. But here, we deal with stigma. And so they tend to come in a bit late and that sort of thing. Here we are so concerned that maybe the daddies will say, well, this is not my child, my family, we don't do those things.
So the context is important. What is the main cause of developmental delays in children?
So developmental delays may be caused by problems that occur when the baby was in the womb, problems that occur during delivery and after delivery. So a baby is in the womb and the mother has a very bad infection, it can affect the child. Or baby is in the womb and the mom drinks alcohol, can affect the child.
Alcohol is not good at all.
When you're pregnant, you shouldn't drink any alcohol.
Drinking alcohol. No. How about energy drinks?
It depends on what's in the energy drink. We even know that when you're pregnant, a lot of caffeine is not good for you. So yes, but alcohol, no. I mean, caffeine, there's you know, just moderate, but alcohol, no.
What can alcohol do?
It causes something called fetal alcohol syndrome. So the babies come out with intellectual disability, like they won't learn well or do well in school, and then they have a particular fashion. So when you look at them, they look a certain way. So that.
How do they look?
Difficult to describe unless you're in a medical class. But then they also tend to have developmental delays. Okay. Like they won't talk when you expect them to do, when you expect them to do those things.
Any form of alcohol, beer, wine,
alcohol.
Alcohol. Wine.
Alcohol.
Okay. All right. So things that happen when the baby's in the womb.
Yes, and then during birth, when the delivery is very difficult, sometimes we have oxygen that is not going to the baby's brain and other organs, and then that can also affect the brain and it causes developmental delays. And then after birth, things like the infection in the baby itself, severe malnutrition, even abuse, you know, extreme abuse could cause developmental delays. Yes, and when we talk about infections, those especially that affect the brain. And a big one is, we've talked about it recently, is newborn jaundice. That will also affect the brain and then causes...
It's not caught early.
Yes, and treated, then it can cause severe disability.
How about smoking while pregnant?
It's not good. You shouldn't do that.
Shisha, ganja, jot. None of them.
You shouldn't smoke.
You shouldn't smoke. Okay, all right. How would a parent begin to think, I need to seek medical attention for my child? What would be the signs?
Anything that doesn't feel right to the parents. Because usually they have this intuition that something is wrong. They just can't put their hands to it. Okay, somebody may come like, I've always noticed that my baby was extra soft. That's floppy. Like when you hold the baby, there's supposed to be a bit of tone, you know, but then I've always felt that my baby was extra soft, but there wasn't really anything happening and so on. And then another one I didn't talk about is chromosomal. That's like how the baby is made, because we have things like Down syndrome and other trisomies. So maybe you've had children before, they all look a certain way. Then you have this baby who looks different. Yes, so you also know that that's a problem that you should bring to the healthcare workers' attention. But there are subtle things. There are subtle things, like they can't really put their finger to it. They can't put a name to it, but they know that compared to other children, this my baby is not. Yeah, but there are big ones that we all look out for. We look for when the baby's neck is able to stand. We look for when the baby is able to sit, when the baby is able to walk.
Well, how do you mean when the baby's neck is able to stand?
Well, it's actually called head control.
Okay.
You know, when babies are born, when you lift them up, the head will sort of just go back.
Okay.
Yes, but at a certain time, the neck is able to stand.
Okay.
Yes, so that should happen.
In terms of months, what's the range?
It should happen around 4 months. Like you said, it's a range. So you have babies having it 3 months, 5 months, yes. But if you have a baby who is 6 months old and the neck is not able to stand, or the baby doesn't have head control, that's a problem. Most babies will sit at 6 months. Even before sitting, there are things like rolling over, transferring, those sort of things. But those are, people don't think about those ones except the big ones. So
what
most
is transferring?
Babies, you pick something with one hand and move to the other hand. Yeah.
Okay. Yeah. All right.
Yeah. So most babies should sit around 6 months. Again, it's a range. But if you have a baby who is 8 months old who is not sitting, then that's a problem.
Okay.
Yeah.
And then you talked about cooing and talking, making sounds.
Yes, that's for the speech and language. Yeah. So if you have a baby who is 6 months old, and then cooing usually happens around 3-4 months and babbling around 6 months. So when there are huge deviations, like you have an 8-month-old baby who is not doing ba 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 ba, then that's a problem.
How do you test for hearing impairment?
So we test by asking for some of these things, because a baby who cannot hear cannot talk or cannot make sounds, and then you have to do an examination of the ear, and then you have to there's a formal scientific way of testing. Yes, that one is called audiology. There aren't a lot of centers in Ghana that do it, but Kolebu does it, and then you send a child to be tested, and they can tell you whether the child can hear and how well. So the other thing is that you can say that a child can hear, but the problem is how well. Maybe you need to shout for that baby or child to hear, and it's a problem. So a child can hear, but maybe not hear at certain frequencies. So sometimes when you know that there's a problem, for instance, if you know that this baby has had severe jaundice, then you are prompted to go and do tests for the baby. But of course, when the parents comes and say, I think there's a problem, then you do things for the baby as well.
Is it true that babies are born blind?
Babies are not born blind. They are born with a very short distance at which they can see. They are short-sighted. In fact, when you are a newborn, the distance that you can see clearly is from the mother's breast to her face. So they are very short-sighted.
So
yes, very strategic.
You have to go for the breast. Yeah.
Yes. And then as they grow, the distance at which they can see gets better.
Okay.
Yeah.
So it's possible that when the distance does not increase, then there's a problem. Is that correct?
With age.
With age.
Yes. So some of these things as well, when you test them or you screen for them, it's not a one-time test. So for instance, you have a mother whose baby was difficult delivery, so then you send, and then they say that the eye is okay. So come back in a year. Mother doesn't come back, because some of these things, they should develop as the child is also developing. So when you go and you don't come back, then sometimes you lose out on correct diagnosis. And like we said, some of these things, when you intervene early, not some, they all, if you intervene early, then the outcome is better.
I mean, God is great. I mean, the baby is born and all they can see is the breast. The whole world is the breast. That's just wonderful. You talked about intervention services. What are the kind of intervention services available for parents who may think that, hey, there's an issue here that needs to be corrected or seen by a doctor?
The intervention when it comes to developmental delay, you see there's a spectrum, and a lot of them tend to go with others. So for instance, if you had a baby who had severe jaundice and has disabilities from it, you find that that baby has cerebral palsy, which is usually a problem, or which is mainly a problem with movements, motor. But that baby as well may have some hearing impairment. So you see, because there was a problem with the brain, it's not only one domain that is affected. So they tend to go with other things. I mean, rarely you find a child who has only speech and language, but often they go together. So it makes the intervention multidisciplinary. So you need so many people to come on board to help that child. And that also makes it stressful for parents. If you have a place where today you see this person, the next day you go and see the neurologist, the next day you go to the speech therapist, the next day you go to the nutrition, then it becomes a burden. But yes, so many specialists need to come on board, because we want the child to be a holistic person. For instance, most of these people with children with cerebral palsy, it's very difficult to feed them. So you realize that they get malnutrition. Meanwhile, if the body is not nourished, then the brain is also not developing. So it's holistic. You need to see the pediatrician who coordinates all of these things. You need to see the speech and language therapist. You need to see the physiotherapist, the occupational therapist, the neurologist, the ophthalmologist, all these specialists specialists need to come on board. And then when it comes time to go to school, that's another problem. You need to have maybe special educators depending on where you place your child.
In your practice and then with the literature in Ghana, what are the most common developmental delays in children?
Everywhere worldwide, it's speech and language impairments. Okay. But then when you move on, then we have cerebral palsy. We probably see more cerebral palsy because everybody knows when you cannot walk, but not everybody knows when you cannot hear. Especially, maybe you can hear, to a certain degree, yes. So when you come to our clinic, you find that a lot of children have cerebral palsy, but the commonest is speech and language, where they are unable to communicate, yes.
How do you help the parents? I must imagine that it must be distressing for parents to face the fact that their child has a developmental issue.
It's extremely distressing, and we don't help with the stigma. I mean, you have even normal children, 1 year old who is not able to walk, and people don't, they are not tactful at all. They are like, hey, why is your child not walking? It's extremely distressing. You realize that Ghanaians can be very blunt with some of these things. They just say it like that. Yeah. Well meaning, I guess, maybe usually they don't intend any malice, but if you already know there's a,
it must be very distressing for a mother or a father.
It is very distressing, extremely distressing. So how we help parents, we speak to them, we counsel them about the condition, we counsel them about what services are available, what we can do for the child. It's going to be a long-term therapy. It's not like treating malaria or pneumonia where you take antibiotic course and you are done. No, it's going to be long-term therapy. The child will need to be followed up for several years. And then there are some outside the hospital setting, there are some groups that you can find online, Facebook and so on, where you can join. But we continue to talk to the parents. The treatment necessarily involves a clinical psychologist, because when a child has such a problem, then it's the whole family that needs therapy, so to speak, because the child is sick, but then the parents are distressed. Sometimes there's a lot of strife in the family, especially the daddies. They say, this one is not mine.
The daddies just reject the babies outright.
This one is not mine. My family, we don't have that.
Wow.
So there's a lot of, and coming to hospital alone frequently is a lot of stress as well. So all those things come into play.
The mothers tend to come alone without the parents, without the fathers?
I think if you walk into any pediatric unit, I mean, it's rare that you find usually it's the mothers. Yeah, well, the fathers may say they are going to look for money. I don't know, but
it would help if the fathers came too, right?
Of course. So sometimes you specifically need to ask that the father comes, because if, like I said, the whole family needs therapy usually. So sometimes you specifically have to say that let the father come, so that you talk to them and explain to them. Yes, and some of these things are not anybody's fault, so to say. Yeah.
Would you classify autism as a developmental delay?
Yes, autism-spectrum disorder. This is a spectrum, actually. So we have the one that you can see, and it's autism, but then there's the mild. Yes, it is.
And for parents who think it's the end of the world, the child has a developmental delay. It's not really the end of the world, is it? In some cases, the children can actually thrive.
Not at all. It's not the end of the world. So, for instance, there is it's a whole spectrum. So there are some people mild, and then there are some people that the disabilities or impairments are severe. So it's a whole spectrum. But even with the severe ones, for instance, just last weekend I met this mom of young Phil Bettino, who's doing wonderful things. Autistic child. He's now a teenager who's doing wonderful things. So it depends on the support.
What is he doing?
He's racing. He's playing piano. He's like some regional champion.
Oh wow!
Yeah. So there are all these things that, provided they get the right help, then they can do. The right help, so you need physio, because our bodies are designed to move. When you don't move them for a long time, then they become so stiff. Sometimes you can't even extend your arm. Physiotherapy, so they don't develop this stiffness. It's called contractures, actually, like it has contracted, you can't stretch. So physiotherapy, occupational therapy, so that the child can become functional, can pick a spoon and take to the mouth. And then you need, maybe the child will only need a hearing aid, and that's it, But if these interventions are not started early. So if you didn't hear all your life, and adults you are now hearing, then you now have to go back and pick all your speech, because to be able to speak, you need to. So when these things happen very early, mobility devices, all those things, then they are functional. In Ghana, we don't have a lot of people with disabilities, children who are doing well. It's because we have problems with stigma, we have problems with costs, because all these things are expensive. You need to be coming to hospital, going, buying medication. They say go here, it's not free, go here, it's not free. So cost, then along the way they just abandon, and the support is not there. They just abandon, and then the child becomes liability, so to speak, because this child who maybe with physio and some mobility devices can move to the toilet, but now you have to move the child to the toilet. You have to carry the child at your back, and the woman are the one who suffer. The man is you have to carry the child at your back or your life. Yeah, so it's really a problem. I think that if we eliminated the stigma and we eliminated the cost aspect, the outcomes will probably be
better.
Yeah.
In terms of the cost, are any of the conditions on the national health insurance?
Yes, so some aspects of care is covered by national health insurance, but the greater is not covered by national health insurance. For instance, if you have a child with a disability who has an infection, most likely it's covered by national health insurance. But if you need to purchase a mobility device, it's not. If you need to do a hearing aid, it's not. Yes, so some aspects are covered, but some are not covered. And these are long-term costs, so it's not small. Maybe today you spend a little, but if you add it over a year, it's a lot of money.
It's a lot of money. So that's a lot of national health needs to step in at some point in time and try and absorb some of these costs. I must imagine that it will be quite expensive.
As for national health, we are talking about it all the time. I mean, recently, after much lobbying, some childhood cancers are on national health insurance. But there's so much that is not on national health insurance. We are talking about it all the time.
Okay. Dr. Cerebral Palsy is a pediatrician with Kolebu Teaching Hospital, CEO of Baby, Child and Co. Before we go out, I just want to check out some of the messages from people that have been sending to us, so you can respond to some of them. The messages are coming at 055-556-1034. Let me just step over to the screen and bring you some messages. Okay, Thelma is there. Good. Yeah. Nice one. Move.
So, good morning, Kath. I've had someone, I'm sure the person is having a swell time. I had all my kids in the UK. My daughter, at an early age, was detected. She had an eye partially blind. We first thought she was dyslexic. It was corrected. She's now an occupational therapist. It would have been a different story in Ghana. Trisha SCC. So there's a perception that our healthcare system is not really what it should be, especially when compared to what pertains in the West.
Just a perception.
And it's a reality, isn't it, Doc? Okay, so a confirmation there. This is a long one. Maybe I can take. Good morning, Kath and Dr. Seram. Developmental delays in children. Great topic. So squint eye impairment is caused by alcoholism and intoxications. In fact, Dr. Seram, I've really learned many things today. This one, if I attempt it, my fancy people will come for me. Hashtag GTV breakfast. Other causes of delays could be in cases where working mothers leave their babies with wicked caretakers who maltreat children.
Yeah,
and more so exposure to radiation.
Abuse can cause developmental delays.
Abuse will cause developmental delays.
All right. Any more?
Interesting. There's so many. Yeah, watching is what you say. Yes, keep watching. Can drinking or pito cause developmental delays?
Even I can answer that question. Pito will not cause your child to thrive. Please
I'm guessing
don't drink pito.
It's because people think it's a natural, like palm wine, and so I'm guessing that's where that question is coming from. But
Pito has alcohol.
Any alcohol, where you're pregnant,
whether it's natural alcohol or...
Alcohol be alcohol. Alcohol
can
be
you
alcohol.
take mashed kenke that is cemented?
Yeah, tough question.
Because we are talking about alcohol, and we know that fermentation is part of the process. So
yeah, I think the alcohol there is much less than
mashed alcohol. No, it's not.
Okay. I need a video recording of the discussion. I think the team will send you a link.
No, so it will be on Facebook. It's on Facebook.
You follow it up. If you are not following us on Facebook, you should do that. You can find us at the Ghana Broadcasting Corporation. Just type Ghana Broadcasting Corporation on the search button of your Facebook, and then you will find us. We're streaming live there. Let's see if we can. We still have the last name saved as Salty. He's not going to be very happy with that this morning. Can you detect whether your child can talk within 3 months?
Yes. If there is an impairment, you should be able to, if you screen for it at 3 months, you should be able to see that there are problems. But you won't be able to make a definite diagnosis. So you say, let's follow the child up and see how the child develops.
Okay, and this one is about hearing impairment. Say, can hearing impairment be corrected? Sampa saying from Samini in East Mapusi district.
Yes, it depends on what is causing the hearing impairment. Some can be corrected.
Okay, here's one saying, watching you live, GTV, thank you, keep watching us. Okay, let me do this quickly. Scrolling, watching you people live. Good morning to all. Good morning to you too, sir. Nice, thank you. We also think it's very, very nice. So this is a topic that we are discussing today. All the information is usually shared ahead of the conversation on the day before the program. So follow our social media pages. Sorry, I'm already in class. I'll view it online after school. That is very, very possible. So join the conversations across our social media platforms. We are streaming live on Facebook and we're streaming live on YouTube. So you can always go back and rewatch. I think I'll hand it over back to Kaf, you and Dr. Seram so that you wrap up. There's so many more messages, but we'll leave that for much later in the show.
Thank you very much, Thelma. So what's your final words on this topic of developmental delays in children? Parents, what do you want to tell them?
There's a lot of information on how children develop. When you take the maternal and child health record book, there's even a portion that tells you what your child should be doing at a particular time. Okay. So it's a good resource that parents can look at. You see whether there are problems. If there's something you're not sure of, just bring the child to hospital, because it's better we reassure you that everything is fine, or let's see the child later, than there's a problem that doesn't get any intervention. Awesome. Like somebody said that the child had an eye problem and so on, and the child is now an occupational therapist, functioning very well in society. The other thing is the stigma. The stigma. I mean, we are afraid to say that we have children with disabilities. That will make you keep your child indoors. You won't even go out and seek therapy, you know. So the stigma, let's do something about it as a society.
Yes.
It's very bad. Okay. These people can develop into functional, you know, this lady in tech, I've forgotten her name, Farida.
Yes,
I mean, yes. So, you know, with support, you can really, the children with developmental, they can really do a lot of things. So, the stigma, let's do something about it as a society.
Thank you very much, Dr. Seram Wadri is a pediatrician with Kolebu Teaching Hospital and CEO of Big Child & Co. If you're not following them on Instagram and Facebook, why? Please follow her, okay? And get all the tips and all the information. She does a lot of great education online, and we need the education. Akpanao. Thank you very, very, very much.